Thank you so much. Wonderful to be here. And glad to see you all. I'm sure you're all a bit tired after 3 days of conference and then a fourth but last day. But I'm glad you all made it here. Let me first explain that where I'm coming from. That may help a little bit. I'm not an urban planner or anything to do with planning as such. I'm coming from the public health side. So most of my work is around epidemiology and health impact assessment. What I'm trying to do is provide further evidence between the link between urban and transport planning, environmental exposures, and health. So trying to quantify how many people get ill or how many people get better, this kind of thing. So. Now, I must say I'm a bit jealous about what I see here of what you're doing, because you can plan things. You can make, I've spoken to people that make master plans, that change the mobility system, they have all kind of ideas within cities. You can change things, and I can't. I just, I observe what is there, and sometimes I build some scenarios of changing, but I can't change anything. And so I'm jealous, because you can make these wonderful plans. But what I would like you to come away with after this presentation is that you are the people that directly affect health. Your decisions, your everyday decisions you make in planning or for teaching actually affects health directly. So I'm hoping that at the end of the presentation, next time you put something on paper or draw something, that you keep in mind this is the health impact of what I'm doing actually. This may have a major impact, much more than the impact that I ever can make, unfortunately, but that's what I'm hoping. And what I would like to do today is just demonstrate a little bit what is the impact of our current urban planning practices on health in cities, and some future scenarios how we could improve planning, or in particular improve health, reduce the current health impacts that we're having. The context I'm speaking in is that we know that worldwide between 4 and 9 million people die each year of air pollution. This is a huge number. It's the largest environmental determinant of health. Furthermore, also more than 3 million people die each year prematurely because of the lack of physical activity. Most of us, like you at the moment, sit a lot, don't get enough physical activity, take the car from home to work, no physical activity, and it's very hard to find your 20 minutes where you can do some exercise. And we know that we're all needing at least half an hour of moderate to vigorous physical activity each day to stay healthy. Furthermore, many people die each year because of traffic fatalities, a lot in lower middle-income countries, but still also if you look at, say, Europe or the US, we're talking Europe 20,000, US 40,000 people per year die of traffic fatalities, particularly caused by the car. Furthermore, we have the climate crisis, as we're all aware of. Many of us in Europe felt it this summer, where the summer was unusually hot and we were suffering. My beloved Barcelona was too hot for me. I suffered. Normally it's only too hot for 2 weeks. Now it was too hot for 3 months. Very unpleasant. But there were, of course, many other effects. Furthermore, we still see population growth in Asia, Africa, particularly this more population decline probably in Europe. But what we see in Europe is also like aging, so that also requires a new thinking of what we're doing in our cities. And then in a lot of the lower middle-income countries, we see still further urbanization taking place. So this is kind of the context that I'm talking about. If we go to more specifically, I focus a lot on Europe, unfortunately, and it's where most of my examples come from. Apologies for all the more international people, but to give you an idea. If we look in Europe, air pollution is still a very large problem in many of our cities. There are 2 types of air pollutants, I would say. The fine particulates, PM2.5. What you can see here is a map of 1,000 European cities with the level of air pollution in the city. The darker the dots, the higher the air pollution levels. Most cities have air pollution levels well above the recommended guidelines from the World Health Organization. But we see very high levels in, for example, northern Italy, Poland, Czech Republic. Air pollution comes from different sources, and particularly in this area, it's from coal burning, industry, etc. But also many of the other cities still have high levels. If you look at NO2, nitrogen dioxide, coming from traffic, we see in particular, in the large capital cities, Madrid, Barcelona, Madrid, Paris, London, this kind of cities, also Antwerp, Brussels, by the way, also very high levels of NO2 because of the high traffic density in the cities. We recently did a health impact assessment to see what is the burden related to these air pollution levels in the cities. And what we found was that almost 200,000 deaths each year, premature deaths each year, are due to the current air pollution levels in the cities. And that if we would lower the air pollution in our cities to the new WHO guidelines, we could prevent over 160,000 deaths per year in our cities. If we would reduce the air pollution levels in these 1,000 cities to the lowest air pollution level, and the lowest air pollution levels in cities are in countries like Sweden and Norway, they don't have so much air pollution, but they measure, around 4 or 5 micrograms per meter cube. We could prevent 200,000 deaths each year in our cities. That's a very large number. Unfortunately, we don't take enough action to reduce this. And also, people don't always realize, what are the consequences of air pollution. And people, when you talk about it, about deaths, people don't believe you. It's only when you have these kind of cases, this poor girl, it was well in the news, it's the first person that is registered as that died because of air pollution. Probably many of you know the story. This is a girl with severe asthma, was living near a busy road in London, and died at the age of 9, well too early. It's the first person with air pollution on her death certificate, while we know so many more people die as a result of air pollution, but it's very hard to get that recognized. She's not the only one, by the way, that gets asthma or got asthma from air pollution. We know that in the EU, 200,000 kids each year get new asthma because of air pollution. About a third of the cases of asthma in Europe are because of air pollution. So there is much to be done to reduce the air pollution levels in our cities. That's one of the big problems. I could give you others as well, but I just want to give you one example, what is some of the health burden related to what we have in cities. We know very well that there's a direct relation between how we design our cities, how we plan our cities, how people get around, how this leads to environmental exposures, and how this leads to morbidity and mortality. If you plan and invest in a city for cars, you're going to get a lot of people that are going to use the cars. If you give them space, people are going to drive. That leads to air pollution, that leads to noise, that leads to heat island effects, because there's a lot of asphalt around, in particular like cities like Barcelona, already a hot city with the asphalt around, we get this very strong heat island effects. You get more stress. We know car drivers are much more stressed. They also have less social contacts, and also they don't get enough physical activity. All this leads to disease. Many diseases are related to this, and then also premature deaths. On the other side, if you design and invest in a city for, say, active transportation, say for cycling, I'm coming from the Netherlands. I'm a little bit biased in a way. I like cycling. That's why I use it as an example. But if you get people to cycle, put in cycling lanes, people cycle. They don't produce air pollution. They don't produce noise. They need to take much less space, so you don't have much heat island effects in that way. We know that cyclists are less stressed. We know they have more social contacts. And in particular, they have much more physical activity, what prevents disease and prevents premature mortality. So in that way, probably many of you are in the part of the urban design part, in the physical design perhaps, some of the social. But you have a direct influence what's happening on the other side. And it's very important to recognize this direct link, this direct pathway. And I just make it a very easy picture to show you that there's a direct link with it. Unfortunately, too often we work in silos. We work in these different silos, and people don't listen to each other, don't work together. And I think that's one of the big problems. This is often what we see in our cities. I just walked from the hotel to here, and I saw a big traffic jam outside. I mean, I thought, oh God, I'm back in Barcelona. This is Barcelona. Also, many of our cities, the public space is very car-dominated. It's like everyone goes by car. The funny thing is that in Barcelona, only 1 out of 4 trips is by car. You know, most people take public transport or walk, but if you look around, you think that everyone goes by car, because this is what our roads look like. And also the car infrastructure takes up about 60% of public space. You know, only 1 out of 4 is by car, but 60%, they take up so much public space that we could use in a much better way. We quantified what is the health impact of current planning practices in Barcelona through different pathways, because you know these cars lead to air pollution, noise, etc. So what is the health impact? And we find that 3,000 premature deaths a year occur because of the current situation what we have. That's about 20% of the total number of deaths. So what we see is that people don't get enough physical activity. So we get more than 1,000 deaths per year in Barcelona because people don't move around enough. They sit too much in the car, for example. We get nearly 700 deaths because of air pollution in Barcelona. Nearly 600 deaths because of noise. Most of the time people say, oh, it's a bit noisy, you know, it doesn't do anything. Of course, noise has a direct effect on your health, on your cardiovascular health. We have nearly 400 deaths per year because of the urban heat island effects. Barcelona is a very compact city, lots of concrete, lots of asphalt, not enough green space, so it gets hot. I mean, 4 or 5 degrees hotter than surrounding areas. And we know that heat kills, particularly the extreme heat. And also because of the lack of green space, we have just over 100 deaths. So you can see the current planning practices have a large impact on people's health. And then we're only talking about mortality. I could also go on morbidity, etc. So what are the solutions? What should we do? Well, that's where you guys come in. That's where you have a direct impact, I think. And I know some of you working on this. I mean, how to plan cities better. So I think we need to look at, you know, land use changes, reduce our car dependency, move to public and active transportation, and green to start with. And I would like to give you a few numbers, what the impact would be on health if we implement these kind of things, as an example. I think a number of new urban models have been proposed. I don't know how new they are for you, but for me they were new, and I was writing about them not so long ago. For example, the low-traffic neighborhood that was introduced in London, where they closed off roads for cars. It's more for active transportation, more temporary measures, I think. Worked quite well to some extent, I think, reducing some of the exposures. The superblock model in Barcelona, I will talk about this in the next slide, so I won't go into this. Then we see what is quite popular, the 15-minute city by Carlos Moreno, designed that we should live in 15-minute walk or cycling ride of all our destinations, whether it's work, cultural events, the shops, education. I think it's an interesting concept. I don't know how easy it is to implement in in practice, but I'm sure you're all working on it and you're all familiar with it. And then one that I like in particular is the car-free neighborhoods. Think about that, Vauban in Freiburg. Beautiful neighborhoods, sustainable housing, lots of green space. It's my ideal place to live. Of course, I don't have the money to live there, and many other people don't have the money because it's so popular, everyone wants to live there, and it's kind of too expensive. So these are some of the new models. Probably there are more, you know more than I do, but this is what I'm working with. But I would like to go briefly into the Barcelona superblocks. Many of you are probably familiar with them. At the moment in Barcelona, on the left side, is our current system, the grid system. Traffic goes to left, to right, up and down, one-way streets. If you go to Barcelona, it's one of the highest traffic density in Europe. They've done quite well to let the car loose. It's kind of ironic because initially Ildefonso Da designed this neighborhoods, this area, to make it a very healthy neighborhood with lots of wide streets, fresh air, lots of green space. And unfortunately, in the 60s, it was taken over by the car lobby, and we got lots of cars with lots of air pollution, etc. in there. The idea of the superblocks is that a block of 9, we cut 4 junctions that the cars can't go through, but need to go around it, and increase green space there and only allow active transportation. That's kind of the basic for the superblock, make it much more people-friendly. The idea was to get 500 superblocks in Barcelona. That was the original plan. Salvador Rueda came up with the plan and was promoting it, but when you go actually to practice, it's becoming a bit more difficult, as you all know. And we don't have so many of them, but here is one of them, Sant Antoni. If you've been to Barcelona, I'm sure you visited. On top, what it was before, the neighborhood, where you can see cars going through. At the bottom, after this, more green space, people walking, sitting. This is taken in the afternoon, so you don't see many people. Still, the siesta is taking place, but you get the idea for how the street has changed, how the neighborhood has changed. We did a health impact assessment. If we would introduce all the 500 superblocks in Barcelona, how many deaths can we prevent each year? And we estimated that you could prevent almost 700 deaths per year if you would implement these superblocks, because you would reduce air pollution levels, you would reduce noise, you would reduce the urban heat island effects because there's more green, because you get people more to walk. And the biggest benefits come from the reduction of air pollution. We know that there will be fewer cars, there won't be air pollution very close where people live, so you get a fairly large reduction. So that would prevent 300 deaths per year. Followed by noise, as what I said, noise is a big problem, particularly in Barcelona, but then also the heat island effects. So you can see by redesigning the land use, you can reduce mortality, the health impacts quite considerably. We're also at the moment looking at mental health, and we see many mental health benefits and also other diseases what actually come with it. Now, most of the time, redesigning space or changing land use is not so easy, but I think there are ways to introduce a much calmer environment. And that's, for example, by introducing and enforcing the 30 kilometer per hour speed limits in cities. Now, many cities are already adopting 30 kilometers per hour speed limit, but it's not well enforced, what is a bit of a shame. But I think if we enforce this also creates a much nicer environment. And recently, the 4 big Dutch cities asked this to be implemented in their cities on all the roads. And I think that actually would lead to a much nicer environment there. Unfortunately, too many people think that the electric car is the solution. And I don't think it's the solution. Of course, I mean, it's been pushed by the car lobby because if you buy sell a petrol car or an electric car, it doesn't make any difference. You still sell a product. So as long as you can sell something, it's great. I mean, You know, and that's true. I mean, the electric car, I mean, it's a bit better. I mean, it doesn't emit as much air pollution because the tailpipe emissions are almost zero, but you still have it from tires and brake wear. Also, it reduces a bit less noise, but as soon as you go a bit too fast, then you still have the noise from the tires, what's the worst. But you know, an electric car still takes up a lot of space in our cities that we can use in a much better way. Also, people still sitting, they don't get physical activity. So for me, that's in a way is not the solution, and we need to look at more low-tech solutions, like the bicycle. You know, many of our trips are less than 5 kilometers in the car. And so this could be easily replaced, actually, by using a... you all want to take a picture of me? That's nice, then. You all can, you know, could be easily replaced by cycling. I mean, perhaps I'm a bit biased. Of course, cycling is not for everyone, but I think many of the trips actually could be replaced. We know that cycling reduces the risk of premature mortality because you have more physical activity. Also, you can, cycling combines, you know, going to your work using transport with the gym. Many people don't have time to go to the gym, but if you cycle 20 minutes to work every day and back, you got your physical activity you need. I mean, wonderful. So less air pollution, less noise, also zero CO2 emissions, at least if you don't count what people eat, because that, of course, also produces CO2 emissions. Takes up much less space, people are happier, and we know that the benefits of physical activity well outweigh any risk of getting an accident, of dying from an accident, or inhaling more air pollution. Many people are too afraid to cycle because, you know, as soon as a cyclist gets killed on the road, it's front page news. And you see it reported. Unfortunately, what doesn't get reported is all these people that are healthier because they do more physical activity. That's not news. It's only the negative news what we get, and that stops people cycling. This is what I would like to see in the cities. I was a few years ago in Utrecht, a wonderful city, so many people cycling. Well, it's actually a bit of a danger to pedestrians. If you walk around, you feel a bit left out, but otherwise, I think it's the example where we see very few cars there, but lots of people cycling, and it provides a much nicer environment, of course. So why don't people cycle? It's what I said, it's because of the risk of getting killed, I mean, often, or getting injured. And why is that? Because in many cities we don't have safe cycling infrastructure. And to get people to cycle, I think you need safe cycling infrastructure, segregated from the cars. You know, as soon as you get people cycling, perhaps it's a different matter, but to get people cycling. We looked at this in 167 cities in Europe, where we looked at the relationship between the availability of segregated cycling lanes and the percentage mode share of cycling. And we found that up to about 25% mode share, so 1 out of 4 people cycling, we found a direct relationship between how much cycling infrastructure was available and the percentage of people cycling. So that's what you actually see here. That's almost a direct relationship. Over that, it actually breaks down. There is no relationship anymore, probably because of other factors that may be more important, or you get people cycling and then it all varies. But for me, it's very important that you need to have this cycling infrastructure. And then, of course, the question is, what comes first? First the cyclist and then the cycling infrastructure, or first the cycling infrastructure and then the cyclist? And that doesn't solve this. But then, I'll come to that in a sec. Also, we estimated that if all these cities in our studies, if we would get them all up to 25% mode share, then we could prevent more than 10,000 premature deaths each year because of the increase in physical activity. So that's a very large number of deaths you could prevent. About the question, you know, what do you need first? Cycling infrastructure or cyclists? I think this is a nice study that came out during COVID, where some German researchers looked at the new cycling infrastructure that was introduced during COVID times in a number of cities, where they took cities where they introduced cycling infrastructure, others were not, and then they looked for how many people actually were cycling. And they found that in the areas, in the cities where they introduced more cycling infrastructure, people were more likely to start cycling than in cities where this was not introduced. So within 4 months, an average of 12 kilometers of cycling infrastructure popped up. I think that was the positive effect of COVID in that way. And the cycling increased in the cities between 11 and 48%. Compared to the control cities where they didn't introduce this. So I believe that, you know, giving cycling infrastructure is very important to get people cycling. Enough about transport, let's think about greening our cities. Unfortunately, too many cities don't have enough green space. Now, I must say, I'm kind of impressed here, this little area in Brussels. I just walked through the park, so it was nice to walk from the hotel to here in the park. Unfortunately, you heard still the cars around the park. But we know that green space is very important for people's health. I mean, there's very good evidence now that it increases life expectancy. We know people living in greener areas have fewer mental health problems, and they have better cognition. Children do much better, their cognitive function. Also elderly, their cognitive decline is much slower. We know people have better mood. We know the babies are healthier, or at least a bit larger. So we also know that it mitigates air pollution, heat, and noise levels. It helps a little bit towards CO2 sequestration, a little bit, because the city areas are normally too small. And also by replacing roads and parking that we have at the moment for cars, if we could replace that with green space by more trees, we actually change an environment that is currently detrimental to health to something that's beneficial to health. We've been looking at this in the 1,000 European cities I showed you before with air pollution. We have the same database for green space, and you can see there's a large variability between cities and also within cities in terms of green space. We look at very small resolution. And what we found was that in our cities, 60% of people don't have enough green space in their area, in their neighborhood. We followed the World Health Organization guidelines that says that you need to have a green space of at least 1 hectare within 300 meters of the residence. So 60% of those people don't have that. We also estimated that you could prevent up to 43,000 deaths, premature deaths each year, if you would green those cities up to the level that the World Health Organization recommended. Now, I don't know if that's possible, to be honest. That's up to you guys. I mean, you plan things, you plan cities. See if you put in a few more trees, a few green spaces to be able to do this. By the way, if you're interested, if you're from Europe and interested in your city, how much green you have, how much air pollution you have, how much noise, and what is the mortality burden related to that, go to the website isGlobalRanking.org, where you can find all the data for this. I mean, it's publicly available. You can look up. They're all rankings throughout Europe per country, estimates for your city, and we're trying to produce more estimates for this as well. We just got funding to increase to continue the work for the next 4 years. Now, a bit more on the local level, that recently Cecil Konijnendijk is an urban forester professor. He proposed the 330-300 rule of green space. I assume that many of you are familiar with it, have heard about it. So the idea is that people see at least 3 trees from their window. There's 30% tree canopy cover in their neighborhood, and they have a green space of not further than 300 meters away from them. I think it's a rule of thumb. It seems to be very popular, like the 15-minute city. People talk about 330-300 rule. wonderful rule. He came up with it. The question is, does it actually work? Is it good for health? Up to about yesterday, there was not much evidence for this, if it was good for health, but we published the paper, so that's why I want to show you. And so we did a study in Barcelona where we looked to see if people achieved the rule, the 330-300, would they have a better mental health? What we found was that, unfortunately, very few people achieved the rule or fell within the rule. Barcelona is a very compact city, so you don't have much tree canopy cover, and there is always a bit this kind of conflict between, tree canopy cover or compactness and this kind of things. So that was the first finding, that too few people actually could achieve the rule. But what we found for those that actually achieved the rule, they had much better mental health. I mean, the indicators we looked at, that self-reported health, medicine use, etc., we found that there was a reduction of 20 to 76% for these indicators if they actually achieve the rule for this. So that's good, and maybe an easy way for in your planning to follow this if possible. For me, what is very important, as what I started off with, I can tell you what is good or bad for health, I can't change it. And I think that's, many of you can actually change it, and you have a direct influence on health. And I think that's why we all need to work together. Urban planners, transport planners, architects, but also the education sector. I mean, we're working at the moment with quite a lot of schools within the education sector to improve the environment around schools. Unfortunately, many of the environments, schools are near busy roads, don't have green space and this kind of things. And it's very important to, reduce air pollution, increase green space. And then, of course, also public health, people like myself, environment people, we all need to work together. Unfortunately, what we too often see is these silos, people working in the silos, trying to improve that little bit of, and I'm guilty myself about this, coming from public health, you always want to increase the number, how you estimate the impact a little bit more, and probably that's not where we gain much to improve the situation, it's more to talking to other people. Can we make changes? Yes, I think. Seoul, South Korea, had a big motorway, they tore it down, they made a nice waterway, green space, smaller road. I love it when I see this kind of pictures. This is another one, Alderley Hospital, Children's Hospital in Liverpool. They had an old hospital with a park next to it. They needed to have a new hospital. They asked the children, what would you like? And the children said, we want to have a more green space, a bigger park to go out. And so what they did, they built the new hospital where the park was covered with green. The old hospital became park, and they have a much larger green space. So this kind of, thinking, innovative thinking, it is actually possible to increase your green space. As what I said before, Vauban, Freiburg, I mean, I'm always dreaming of this. Before I go to sleep, I think, I wish I had a lot of money to be able to live there and have all my neighborhoods, all the neighborhoods everywhere like this, lots of green space, nice housing, etc. But I think this is something what we're aiming for. Having said that, a little bit closer to my home, you need to have things where you look up to, what you would like to introduce. And I think one of the streets that I really like in Barcelona is the Rambla de Poblenou. It's a Rambla, a walking street. People walk. There are cycling paths on the side, very few cars. Lots of green space, much nicer to walk there in the summer than many of the other streets. You have people living there, you have shops, you have schools, everything is there. It's a wonderful little neighborhood where people are together. Unfortunately, it's now being discovered and it gets a bit gentrified. But otherwise, I think this is what we should be aiming for our streets, to make them much nicer. I mean, I showed you the picture before of Barcelona. This is the area of Barcelona I don't like, but this one is certainly an area where I love to hang around. If you want to read a little bit more, whatever I'm talking about, recently I published a couple of papers. You can find them there. And I can send them to you if you're interested. And just one plug, I mean, if you're not conferenced out yet, and you want to go to a very interesting conference, please come and visit us in Cities in November, Urban Transitions. We're trying to bring together urban planners, transport planners, environment people, health people, whatever you think of people working around cities. We've got around 500 people coming. Even if you're not interested in the conference, come anyway, because Cities is a wonderful place, particularly in November. You still can swim, there's still sunshine, you can walk around, so don't bother. I mean, just say that you're coming to the conference and you just take a little mini holiday. I think I'm going to leave it with this. Thank you so much, and I'm happy to talk to you over the coffee break or later, or please feel free to email me that. Thank you.